I love you.
I'll lock in.
Well, good evening, everybody. This is Dr. Ellithorpe with Tustin Longevity Center. Talk to the doctor or ask the doctor. We here are the TLC Health Freedom Tribe, and we are just trying to be a educational outreach for their patients and your friends and family. You might have various questions. And we started this YouTube series so that you would be able to type in your questions. If you're on YouTube, you can put them in the chat, and then I'll see them emerge. Then at the end, we will hope that you like and subscribe and refer to other people that might want some questions answered. We are a integrative functional medicine group of about 6-7 doctors here, and we are trying to do preventative medicine and natural medicine mixed with the best of standard of care. We're not trying to give you specific management here. This is meant to be generalized and kind of topical responses. So if you have a specific problem, please call your doctor or make an appointment or call our front office if you're one of our patients. And we started another program where you can type into office@tlcdoctors.com. That's office@tlcdoctors.com. And now people are starting to write in their questions ahead of time. So I do have a list already here, and I will be trying to get as many as I can answered this evening as well. I'm sorry that we started a little late today because I was being interviewed by a functional medicine program, and I wasn't sure it would end in time for me to start right at 6 o'clock. So here we go. We'll start with what I see on the screen, and that is Jennifer. And Jennifer says, "Hi, Dr. Rita. For a friend regarding breast screenings, can thermography replace mammogram?" Well, in California, the standard of care is to recommend a annual mammogram, and that is what is expected to be offered to patients because that's the standard of care. Now, thermography is a camera that is picking up heat signatures. So we are machines, biochemically emitting energy all the time, and so we emit heat, and we can pick this up on a picture. If a cancer or a area of infection is emerging in the body, there is more blood flow to that site to try and help it get rid of an infection, deliver white blood cells, remove debris. Or if it is a cancer growing, it will develop chemokine signals that will attract more red blood cells to accommodate the tumor's more rapid growth and the normal cell behavior at that site. Therefore, if we see asymmetry and a site of heat that looks out of place, then we become concerned. We don't make a diagnosis off of this. So the physiology of the early development of cancer could potentially be picked up before a mammographic image of it is done. But there are no funded studies to do comparative evaluations. To my knowledge, it is not being recommended as a replacement. So with you and your doctor, with you doing your own self-breast exam every month, with your healthy lifestyle, with your lab, and with your prior mammograms and pelvic and breast exams with the doctor, you and your doctor will come to a plan together and discuss this. Of course, to maintain your license to practice in California, your doctor will offer you a mammogram and tell you this is the standard of care. But you own your own body, and you will decide with the best of information we can give you how you will proceed forward in your own risk management for this. So we cannot say it replaces mammogram with thermography, but we can say it's another tool. And we as physicians want to look at anything that does the least amount of harm. And of course, thermography does not do any harm. Mammography does, however, have compression and the trauma of compression and radiation. So hopefully, maybe the future, there will be finances to do some comparative studies. Let's see, the next question is KS. Hi, Dr. E. Do you have any concerns with heavy metals in hair coloring? And the answer is yes, because fireworks are really just burning up certain metals. So magnesium has a color, aluminum being burned has a color, other copper has a color being burned. So fireworks and hair dyes are these heavy metals are an issue of concern. I know there are natural products that are out there, and certainly I think anything to do with lightening your hair, such as putting streaks in your hair, I forget what that's called. This is a bleach, which would not be a problem. So I don't really support hair colors at all. And yes, it is a concern. Dolores says, hi, Dr. Rita. How are you? You are a blessing and appreciate all you do. Well, God bless you, Dolores. Thank you so much. And I am so happy. I am so content for all that God has done in my life and all the things that He has given me. My education is not my own. It's what He provided, my parents, my father in food research, my mother, all these wonderful things, and the shoulders I've stood upon. So on the interview I just did for a functional medicine core curriculum on lipid replacement therapy that I just did for the cell membrane, they ended the question, I think they do it with every doctor they interview, they say, what do you think medicine, the evolution of medicine, what do you think that is? And my statement was, I hope medicine evolves where the doctor and the patient develop a deep and long relationship where the patient becomes very much aware that that doctor they have locally really cares about them, and that doctor listens and learns and is open to other things out there rather than some dictum from some bureaucrat in some faraway place. We have to have doctors love their patients, and that's part of your clinical being. All right, so thank you so much for those kind statements, Dolores. Here's Talent, and he said, here is the link where you can submit your questions for us to answer. Of course, if you are watching live, you can post your question here. So at the end, if you look at the bottom, he will put the link there where you're able to do a question. And if you cannot make it for the program and you type this in, what I'm going to do is I'm going to put a check mark on what I was able to get to, so that I will give this back to the office, Talon, and he will go through this and he will email back those people that I did respond to it live, so they can go back to the program and look for their response. So hopefully that will encourage people to participate and grow and learn. Jennifer says, is iodine helpful in a post-radiation nuclear poisoning situation? The answer is absolutely yes. I read of a Japanese doctor who saved his patients with iodine. How much would the dosage be? Well, you know, when I was on active duty as a military doctor, one of the things I had to go through it was in training for nuclear, radiological, biological, and chemical decontamination. And iodine was an integral part of that. So the iodoral that we have here, or the iThroid that we carry, is a 12.5 milligram capsule or tablet. One a day is more than adequate. to be afforded the protection that the radioactive iodine from a nuclear exposure might give you. So I think taking one 12.5 milligram tablet is just quite fine. Harlow says, God bless your practice. Okay, Harlow, God bless you back. Thank you so much. Talon adds, the link form will allow you to submit a question anytime on a future episode. Better than emailing the office, as we get a ton of emails. So I guess some emails have come through and they did not understand, my staff, when they got it, that this was meant for this program, and they tried to find the doctor that that patient was attended to. So hopefully this program that we'll be doing with our link will keep these questions active, and we will follow through on them. Thank you. The link is also in the description below the video. Thanks, everyone. We love and appreciate your participation. And yes, my staff is wonderful. And everything we do here, you have to understand, when you say you're grateful to me, you're actually saying you're grateful to all my staff and doctors, because we are a team, a family. And of course, this is a family business with my son and my husband working here and so forth. But we are the result of everyone, and Talon certainly works his butt off to try and do the right thing all the time. All right, so thank you again. Constance says, Talon, what about submitted questions today? Will Dr. Rita answer these? Well, I'm going to try and go through as many as I can today. Christina says, hi, Dr. Rita. My son blinks his eyes a lot and did well on his last vision test. Lubricating eye drops don't seem to help. What would you recommend? I'm going to say B vitamins, a methylated B complex. We have TLC methyl B complex. Very often, eye irritation, the little muscles here from stress can make you blink more often. And so a very good methyl B complex might be very helpful. Now, another thing that I personally do now that I'm much older and nearly 70 is I take my Argentine silver. I take a Q-tip and I'll take my glasses off at night, and I will put it in the liquid, and I'll put the Q-tip right to the corner of my eye, and I'll feel that cool, cleansing, antiviral, antibacterial, antifungal here. And then often I'll squirt it up my nose. And so that is very refreshing and helps prevent inflammation and irritation. So methyl B complex and maybe the Argentine silver would help. Carol says, I have a teacher who says she has COVID. I saw her 4 days ago. How long should I stay away from people? Carol, I have patients who come and see me all the time here, and they are being treated and managed for various disease disorders. The flu, strep throat, COVID, various things. And I don't stay away from anybody, and I don't do anything different that I haven't been doing for 41 years practicing medicine. So I think this concern about quarantining is a dubious and foolish thing based without science. And I have never seen, in the 2+ years that we've gone through with COVID, and we've worked every day, we never closed. I didn't get anyone ill and no one got me ill. So if we have a good terrain, if we're drinking our water, keeping low carb, exercising, getting a good night's sleep, not eating late at night, taking our vitamin D, taking our multivitamin that has zinc in it that I've had everyone on, taking our enzymes, using iodine, using Argentine silver, there is no asymptomatic transmission. This is show me the science on this, because 41 years and uh, I've never seen asymptomatic people make other people sick. So that's just the way that goes. So I wouldn't worry about it. I'm seeing people with COVID all the time, and I don't make anyone sick, and they're not making me sick. All right, Kathy says, I was going to ask my doctor Friday about turmeric, but I thought to ask why I would want it from you. I am a breast cancer patient, stage 2, with a gene mutation and more. Chemo infusions done, Linparez, and now for now. So, well, uh, chemotherapy creates a lot of cell membrane damage. You know how I have my picture here all the time of the bilipid healthy cell membrane? And right here is where there's a blowout in the cell membrane. And chemotherapy, although it tries to be designed for just the tissue, there is a lot of collateral damage. That collateral damage creates all this debris here, these little particles you can't see, and they float around and they signal alarm, and inflammatory molecules are recruited. Therefore, turmeric works as a natural anti-inflammatory, so that you are not having secondary cell damage from this. So I am in favor, especially if you've gone through chemotherapy or radiation, or had some illness, or you suffer from chronic inflammatory disorders, of which many people are doing from the current corrupt, lifestyles with high carbs and food allergies and heavy metals dumped in the sky, geostratospheric engineering, and staying up too late, poor sleep cycles, eating too late, not exercising enough, not drinking enough water. Remember, we are 98.6 roasts. We're 150-pound roasts, slowly cooking at 98.6 degrees all the time. So these natural anti-inflammatories, drinking enough water every day, getting a good night's sleep, taking systemic enzymes, these are all so helpful in maintaining a good life and lifestyle, and maintaining our membrane integrity. So yes, I would do that. Christina says, I'm curious, when you fast and your husband doesn't, do you still sit with him while he eats his meal? Dinner time has always been a way I've connected with family, eating and conversing. And the answer is yes. I will go to a dinner party if I'm invited, but I will just sip my black coffee or my tea. And it's just the way it is. Very often people eat too late at night, and if I'm ever invited out, I'll go, but I won't eat. For instance, at church, very often, another example, there's too many offerings of foolish, immune damaging, cell damaging, high sugared up carbs available. And so I will never participate while everyone's eating around me. So yes, I do pray to God, because I know I need to be an example to my patients, but we need to be an example for everyone else. I ascribe to that we are our brother's keeper. We are to have an answer of the hope that lies within us. So we have to always be thinking of others and live for them. So yes, I would sit with him while he's eating. So praise God on that. Let's see. Uh, Constance, did you have time to research on Quinton? Yes, looks like a great product. Quintessential 9, also a Japanese water system called Enagic to purify and then add electrolytes and produce Kangen water. Yeah, these electrolytes and these water systems, water is critical. It has to be alive. I don't like distilled water. Water needs to be filtered so that heavy metals and toxins and volatile organic acids that might be dissolved in it medications that have been urinated into the system and filtered through. We have to have filtered water, but then we overfilter it to the point that we take out all the beneficial minerals, and it becomes dead water. So I'm not against Quinton water, and the research. There is another water out there called vortex water, so that the spin of the molecules. So I am not going to get down into that deep of the weeds with it. I want people to filter their water as best they can, and not to feel bad they don't have some super duper multi-$1,000 system. Even if all you can get is a Brita carbon filter for $20 at the store, then start there. That's valuable. Don't think it's not valuable. So filter your water, and then consider making sure that you have some electrolyte, multi-mineral supplementation, so you're getting healthy minerals with it. Nora says, hi, Dr. Rita. I also appreciate your support. Thank you. Thank you in advance. My cold seems to recover and restart. I don't recover from it. I also cough. It is a dry cough. So Nora, I don't know if you're a patient or not, but if you have persistent symptoms, please see your medical doctor or myself if I'm not recognizing your last name and you're our patient here. We want to look into recurrence and persistent coughs, absolutely. So do be seen for that. Now, your age, how old are you? What might be some comorbidities? Are you a diabetic? Are you eating too late at night? What is your blood type? Do you have food sensitivities you're eating that makes you more congested? Are you eating too many carbs that depresses your immune system? Do you have a lot of heavy metal toxins in you that are oxidatively stressing your already aging body and immune system? I mean, there are so many levels that could be looked at, Nora. So if you have recurrent and persistent cough, please do see your healthcare provider, and let them go through the litany about who you are, your age, your comorbidities, what is your blood type. Talk about doing food allergy sensitivities, looking at your gut microbiome and seeing if it's healthy or not. A large part of your immune health is lining from your mouth to your anus, and 70-80% of your immune system is there. So you need to work with your doctor to look at these things and guide you through that, where the best emphasis of maybe some supportive lifestyle changes, nutrient supplementation. Would you benefit from a series of high-dose vitamin C to try to kind of detox you from volatile organic acids, PCBs, benzene rings in the air? But see your doctor about that, Nora. May says, hi, Dr. Rita. I have a heel pain for quite some time now. What can I do to ease that pain or to treat that? Thank you and God bless. Heel pain, right where the plantar fascia inserts at the base of the heel, and then it fans out to the toes. That's your plantar fascia. And where it attaches, will get a calcification, a spur. And then you can step on your heel and you can have micro cracks and trauma in that calcification to the tendinous, softer tissues. So what we would do is, I had plantar fasciitis once, a few years ago. I think I was 65. And I was surprised that I developed it. But with life, you don't always take care of yourself. And I'm human, and maybe I was eating improperly or not drinking enough water. So I immediately went on a 5-day fast. I just drank water. Now, would a 1 day fast be helpful? Yes. Would a 2 day fast be better? Yes. And by that, I got rid of all the food allergy inflammation in my body. That helped me a lot. And then I used my systemic enzymes, Vascuzyme and Vitalzyme, and I used 5 or 8 twice a day, quite a bit, along with my other routine supplements, my D with K2, my multivitamin, my B complex, my Juice Plus, my iodine, my what else do I take? My quercetin for my allergies, DHIST. So I did that, and it was maybe 50%, 60% improved. But then I went to Pilates. It was the first time I went to Pilates in my life. And I explained, I am surprised. It's an aging sign. I have pain in my heels when I first wake up in the morning and step. I was just in so much pain, and then eventually you walk on it enough, and then the pain diminishes, and I went about my day. So I was doing all that, and I went through Pilates and some stretching. Uh, Actual stretching, and that I never had the pain again. So maybe some form of Pilates footwork. Now I do the whole thing, but she really worked on stretching, showing me maneuvers like you could stand on a piece of wood, a 2x4, and put your toes up on it and kind of lean forward and stretch that out. So various things you could do, but stretching, drinking enough water. I really had to say whatever my pounds were, half of that I had to get in every day. I took my enzymes. I stopped eating for several days, and then I stretched and stretched, and it went away, and it never came back. So hopefully that would be a help to you as well, May. Michael says, how long does chelation therapy remain effective if I get 10 treatments from your clinic? It's absolutely valuable in that you're reducing your total burden of heavy metal toxins, aluminum, cadmium, mercury, lead, arsenic, and it goes on, and even uranium, because we're still being contaminated from Fukushima radiation as well. So every chelation is a benefit. And even if you did only 10, and then 2 years from now you did another 10, it's going to add up the direction you're headed. It's all good and no bad. So how long will it benefit you? We would say in the studies with the TAC trial, the trial to assess chelation therapy, and if you go on the YouTube and it says TAC, TACT, update 2019, Dr. Lamas, Lamas, you'll see a 15-minute summary by the head of cardiology at Cedars-Sinai that supports chelation therapy. And he reviews the TAC trial, referencing the fact that for 5 years after these people, I think they did 40 in the trial, they did 40 within a 1 year's period of time. But even 5 years later, the benefits were still there. So you would have at least 1/4 of the benefit over those 5 years. So yes, Michael, it is a blessing. Yeah. Harlow says, Dr. Rita, will you be at the RHPC in Sacramento? I don't know what the RHPC is. Sacramento is the state capital of California. So Harlow, you got to let me know a little more what that is. Email us or send us an email so I can find out. Kathy, thank you. I also drink all my water daily after listening to you. Great information. Well, isn't that humbling? Here we would like to think we're so smart and we're so trained. And listen, what we have been taught for the eons of time is simple and humble lifestyles are the best. The more entertainment we put into our lifestyles, entertaining food, eating whenever we want, turning all our hydration into an entertainment. It is too much for our immune system to try and sort out. Now, yes, if you're going to have the occasional party once a month, probably no more than twice a month, and you want to have a fun drink, have it then. But to think we're entitled enough that every time we go to the grocery store, we have to bring entertainment drinks home or entertainment food home, we have been self-deceived. All right, Robert says, uh, 2 months, but I finally got into a rectal surgeon. He said I didn't have hemorrhoids, but I had a small tear. Okay, so a rectal tear. Said it would heal and to stop all wipes, hydrocortisone cream, etc. Okay, and it goes on to say they want me to take stool softener, lots of water, and if necessary, addition magnesium and lots of walking. I am taking 5-Vitalzyme twice a day, low carb. He said it will heal by itself, and it should. One thing you might do is take that Argentine silver spray and I don't know if you're married or not, but maybe your wife could help spray that area for you. It's a little awkward to try and spray yourself. Or you could put a little water on some tissue and self-pad yourself in that region. That is a tremendous antiviral, bacterial, fungal treatment locally. The other thing is if you drink half your weight as ounces of water every day, you're in pounds, if you are taking your enzymes and if you are taking magnesium, one of the ways that it's nice to get that magnesium in, Robert, is we have the OptiMag Neuro powder with a Vitality C powder. And if you take a scoop of each, put it in some water and take that before bedtime, you could do that 4 times a day. Maybe if you did it 4 times a day, your stool would be so loose it would be diarrhea. But you could play with the amount to keep your bowels nice and soft. Probiotics and prebiotics are very, very important. I spent the weekend listening to Dr. Rob Fisher, I think is his name, Fisher, out of San Diego. And he had a lecture on the microbiome, and they're finally starting to look more scientifically at the various bacteria and microbacteria, fungi, yeast, all that stuff that's in our stool. And they're starting to realize there is so much genetic information, so much products, bacterial digestion waste products that are impacting our immune system, impacts our vagus nerve and our mood, and it impacts the health of the lining of our gut, even our longevity. It impacts weight loss, and on it goes. It is just so fascinating to learn about probiotics. So there are certain bacterial strains that are associated with weight loss. We are learning there are certain disease processes where you can take a stool transplant from a healthy person and give the other person who is ill, like with C. difficile, Clostridium difficile, chronic diarrhea disease, or inflammatory bowel disorders. We are learning you can give them a enema stool transplant of healthy stool, and it revolutionizes the health of the lining of the gut. Even children with behavioral autistic disorders, we are finding too many antibiotics have hurt the stool microbiome, and it has led to breakdown of the lining of the gut, hurting of the immune system, and this syndrome of chronic disease, autoimmune, mood disorders, and then with chronic inflammation, the inflammatory bowel disorders, even colitis, and then colon cancer, and on and on. They've even taken they took overweight people and they took bowel samples of the stool and they did enemas on rats that are raised in a sterile environment, and they infused that rectal fecal implant into the rat, and the rat became obese. Then they took other rats and that are sterile, raised without any bacteria, and they took thin people and to the rats that were obese, rather, and they then put the stool transplant into the rats that were obese, and they lost the weight. So then they're starting to find out which probiotics, which prebiotics seem to be linked with the microbiome that's associated with healthier utilization of food and weight maintenance. Oh, it's just so fascinating. So you should be on a probiotic. I said all that to say you should be on a very good probiotic. Let's see. Then we had Robert say, also I take 2 doctor's bar a day. Very good, because there's prebiotic, probiotic in that, and that fiber volume really helps the stool have a volume and manageability. Anyway, to increase the speed of healing, it is at times fairly painful and was originally caused by hard stools. Yeah, I have found using the doctor's nutrition bar really provides membrane phospholipids to heal the gut, heal your lining. It provides the probiotics, it provides the prebiotics, and it provides the highest dosing of fiber I've ever seen, both soluble and insoluble fibers. Yeah, I like my bars. Sean says, thank you so much for your dedication and all the guidance you provide your patients about the Health Freedom Tribe. God bless you. And I think Sean is the one who gave us the title, TLC Health Freedom Tribe. So see, we are a family, aren't we? We are our brother's keeper. And let the healing begin. Oh, and here's Deborah, my sister. Hi. I am listening to you. Well, I'm surprised. You know, you can never listen to your baby sisters, you know. Anyway, so Deborah says, hi, I am listening to you while I am doing my daily walk tonight. Good girl, Debbie. I am so proud of you. Blessing to you and all listening. And blessing to you and your wonderful family, Deborah. But you know what's so nice, even though you're so far away, Debbie, and I can't have coffee with you, it truly is a blessing to be here at work every day. And when I see my patients come in, I tell you, for the most part, Debbie, it's like family here. It's like I have all these brothers and sisters, and I feel so lifted up in prayer and loved by them. It's just wonderful. Carol Travis says, oh, Debbie, one thing. Did you hear about the Energizer Bunny that was arrested? Did you hear about the Energizer Bunny that was arrested? Yeah, he was charged with battery. There you go, Debbie. There's a joke back for you. All right, Carol Travis says, Dr. Klinghardt agrees with what you said about stool implants. Thanks so much. Absolutely. Yes, I like Dr. Klinghardt, and he was actually a teacher to me back in the 1990s when I was doing my doctorate of integrative medicine. And so what a wonderful gift he brings to the world. And I've really been blessed with all these wonderful inputs in my life. So everything I have, folks, God has given in the first place. So now let me go to this here. Let's see if I can answer as many questions in 15 minutes. All right. So Gail Mullen says, my husband, who is 76 years old, has bone-on-bone osteoarthritis in one of his hips. He has been very physically active with exercise his whole life. Most people are saying he should have a hip replacement because of the pain he asks he has been experiencing. However, we have also seen a doctor about stem cell therapy. What are your thoughts on the success of such therapy with someone in this condition? Well, Gail Mullen, I would certainly say make sure first that your husband is drinking half his weight in pounds as ounces of water every single day. Hydration is the number one healing mechanism that the Lord uses on our bodies. And if you're going to get any healing to that bone and the capsule there, you have to get it into there through diffusion. And with diffusion, the one tiny synovial little artery is it. And you have to have good hydration. And you have to give it weeks and weeks of this. Then I would be on systemic enzymes to bring down the inflammation that the micro trauma is doing. Then I would be on an anti-inflammatory like curcumin or turmeric combination. We use TLC Deflame, or we use Turiva is the name of the other one here. And I use it every day of my life. And I'm so thankful at almost 70, I have no joint pain. Oh, then you could, be very low carb, because you're going to clog up those little capillaries with a high carb diet. And I would probably eat more like a carnivore, because you need all that cartilage, chondroitin sulfate, glucosamine sulfate, which is rich in a carnivore diet. Then that'll bring the sugar down from not clogging up the little capillaries. And then I would consider stem cell treatment. There's even, we often have done in the past here ozone injections right into the hip. That is stimulating and healing. But I am all for stem cell trial. It certainly is worth a try. But you got to get the water in there, and you got to get the carbs down, and you got to get the healing protein and fats up, because that's what we're made of, and cartilage is made of. It's not made of fruits and vegetables. And then use the enzymes systemic, like Vitalzyme, Vascuzyme, and I would use 5 twice a day minimum, maybe 8 twice a day. And get a good night's sleep, because our healing is at night and not late at night. When the sun is going down, growth hormone secretion, our secretagogues start coming out around 9 p.m., 9:20, 9:40, 10, 10:20, 10:40, 11. And then we have a tiny little squirt maybe around 4 in the morning. And it's irregardless of how busy your day is. If you're not in bed by then, you're going to miss that natural growth hormone. So that's what I would do. All right, Christine LeBlanc says, can SIBO, small intestine bowel, SIBO, small intestine bacterial overgrowth, be remedied without antibiotics? Well, there are those who would argue that the rectal implants are the way to go. Now, I think it's only on Medicare covered for C. difficile infections. But I am along with, if you're doing these other healthy things, Christine, drinking your water, natural hormone replacement, and by the way, for the lady with the hip pain and her husband, testosterone for muscle tone and range of motion, that would be another item that you might consider using. So being on your natural hormones, drinking your water, getting in your probiotics in your gut, maybe a fecal transplant implant with the healthy flora of a healthy person. These are the things, and don't feed your gut the sugars and the food allergens. Rich protein, fat-rich diet that is being argued should include SIBO for insurance coverage, but so I think it can be, but there is no standard of care that will support that. Damien says, blessings and greetings. I was recently at Healthcare Pharmacy on Newport Boulevard, and I noticed that they carry some supplements from Orthomolecular. Among their selection was a bottle called Cosmedix, 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 and I bought it. It supports hair thinning and hair loss. The ingredients contain biotin, saw palmetto to prevent the dihydrotestosterone production. It's a aromatase inhibitor herb, horsetail, etc. When I got home, I noticed the fine print on the bottle. There is a warning message that says, consuming this product can expose you to chemicals, including lead. That sounds scary. I know lead is a heavy metal. Should I discard the bottle, or is it okay to take the capsules? What should I do? I value your advice. Well, that's Prop 60. That is a California statement that if you can't get every food item and supplement or something at a certain screening level guaranteed, then you have to label your products that is possibly contaminated. But let me tell you, folks, our air is contaminated, our water is contaminated, dyeing your hair is contaminating. It lands on the fields, it grows up into your plants. Your animals eat the plants. So this is really superfluous. And I know the company Orthomolecular, and so you would never get a product made that is nutraceutical if they had to comply with the ridiculous rules. Let's first stop geostratospheric engineering and the chemtrails. Let's first stop these known things, and then we will address it. So I would use it. I would not worry about it. Okay, Christina says, thank you, Dr. Ellithorpe, for all you do for your patients and everyone online. Do you have a recommendation to help tennis elbow to my arms? I've done fasting for 2 days and Vascuzyme, and it only helps a little bit. I'm wondering if I should try a 5-day fast. Thank you for your help. Well, remember, tennis elbow, you know, you're working on it and you're striking and you're striking and you're jerking that epicondylitis with your tendon over and over and over. So I think I would stop the tennis, which is the cause of the recurrent micro trauma on that lateral epicondyle there, along with maybe a 3-day fast. I don't know if you can get to 5, that'd probably be great. Along with be persistent with your water, be persistent with your enzymes, and maybe take Turiva or TLC Deflame. That's the turmeric thing. I think the other product is called NRF2 factor. These are high quality turmeric, curcumin, and then see if that will break it for you. And you know, see your doctor. You could get infrared. You could get ultrasound. Doing you know, certain physical therapy, external and internal rotation. You know, bring your arm all the way. You know, see a therapist who is very good with professional tennis players. There are certain moves that you could do to help enhance the microflow of the blood. Chelation therapy would help. High-dose vitamin C would be a quick thing to do to disinflame it. But it will work if you hang in there, because we're designed to heal. And keep those carbs low. Find your blood type. Find out if you have food allergies that might be aggravating it. And then maybe go to something less hard or hitting that and putting that sudden trauma on your epicondyle there as well. All right, so what's the next question? This is Ruth. Ruth says, this is not a question, but rather a suggestion for people who want to buy ivermectin. The site is ivermectin.com, ivermectin.com. The cost is 200 12 milligram tablets for $200. So that's a lot. To get 200 of the 12 milligram for 200, that's great. Shipping is $450. Is manufactured in India. Yeah, that's where I got mine. And it was shipped out from South Carolina. So, all right, so that's what she is finding, ivermectin.com. And I got mine from India also. And then the next one is Dorothy. Dorothy is saying, I'm referring a patient with bone cancer that is new in our church. Her name is Terry. She is a trained nurse. She wanted to hear my story, came to church. And so she says she raised her up at that clinic for coming to see Dr. Rita. Okay, well, we would love to try and help her. I do have to say, ladies and gentlemen, I'm not seeing any new patients, but I'm focusing on caring for the ones I have and to work on helping my current doctors and developing them. And the new Dr. Habermill coming. She's already here. Dr. Johnston will be here within the month, and maybe another doctor will be here after that. So I need to train these doctors, Lord willing. So pray for me. And we know that along with the standard of care of their oncologists, there are many things that we can do, and we've had such success no matter what type of cancer, from the worst, probably glioblastoma multiforme, and our patients live, they don't die. It's just such a glory to God thing. When we put them on these lifestyle changes that inhibit excessive rapid growth of tumors, which is, of course, the ketogenic carnivore type diet. And then we detox them and high dose vitamin C and certain nutraceuticals, certain enzymes, and so forth, rebuild their immune system up. Yes, we want to work with their oncologists and help them. So thank you, Dorothy, for that referral. And Constance says, did you have a chance to research Quinton? Yes, we did, and I think I answered that already. Doug said, how long is this wonderful person going to keep helping people before she retires? Oh, bless your heart. You're in, well, it's embarrassing. Says kind things to me. And he says he's praying for me. So thank you, Doug. God bless you. I love God. I love his creation. So I can't help myself. And I love my family and my husband. Okay. Elaine says, is it okay to take herbal teas, vitamin, minerals, or medications while on a extended fast? Yes. Yes, it is. Now, I guess I have a gut of iron. I'm B positive blood. Of course, the only thing I don't take when I'm on a prolonged fast is my orthodigestzyme, because if I'm not eating anything, I don't need anything to help me digest anything. So what I'm going to say is, yes, please feel free to go ahead and do that, and as you can tolerate it. Narita Galagos says, how to perform cellular detox safely when detox pathways are blocked, how to optimize liver function. So that's why you come to a doctor, a integrative functional medicine place where we can hear your story, put your age, your blood type, your life stressors, certain lab studies, maybe, and certainly a stool probably needs to be done to see your ability to detox. Then we will guide you through it. So yes, how to do it? Well, we would recommend that you work with a functional medicine doctor on that, Narita. Gail says, just want to say thank you for your staff and the blessing. Thank you, Gail. Thank you so much. Thank you for saying that about the staff. Again, I'm just an extension of all the wonderful support I do get here. I'm talking about even my new employees. They are turning out so wonderful. We work very hard to try and screen to hire the people that love people, you know. Christy says, can you explain metabolic disease? Christy asked the question, can you explain metabolic disease? We believe that over the decades that industrialized farming, lobbyists, and capture of at the administrative state, creating regulatory and favored players, has created a sick environment where certain toxins are allowed. You know, we're just happy for some of the Monsanto judicial rulings that allowed these poor people to be recompensed for their cancers they got from some of the pesticide exposures from these companies. So when we're talking about metabolic disease, our people are seeing such sugar, such electromagnetic energy exposures, such heavy metal, chemtrail, geostratospheric engineering, such stress with messaging and the environment of rapid communication and not shutting the phone off and learning to discipline, such chemicals in the food, so many glyphosated, genetically modified foods, such demonization of healthy fats that make up the bilipid membrane over the past 50, 60 years, indeed, and then such liberal use of antibiotics that hurt the biome, drugging and over-the-counter medications that have secondary impacts on mineral and nutrient deficiencies from chronic use of, let's say, H2 blockers like the purple pill, or having chronic use of acids creating maldigestion, non-steroidal anti-inflammatory over-the-counter drugs creating chronic gastritis and bleeding, and it goes on. So when we say metabolic disease, we're talking about these things, Christy. And then the last one I have here is Rebecca, and she says, I'm 47 and convinced I'm perimenopausal. My mother completed menopause at 44. Am I also at risk of completing menopause early? And the answer is yes, Rebecca. And for all the reasons I just listed about metabolic disease, these stressors in our life are prematurely aging us and harming the rest and repair and harmony of our cell-to-cell communication. And it's pushing us into an earlier aging degenerative state. So see a functional medicine doctor. Try and get someone who will give you the time to find out your stressors, your lifestyle. Are you married? Are you remarried? Are you in a divorce? Are you in a busy job? How many children do you have? Have you moved around a lot? Do you have friend support, church support, family support? All these things impact us and ourselves. So, and then consider natural hormone replacement and trying to keep you younger longer, and many other things. So see a functional doctor. So we are now at 1 hour. So let's see. Anyone else? All right. Christina said, hi, Dr. Rita. My 18-year-old daughter went to France a few weeks ago. She had COVID in June. She has gone to a few restaurants and has gotten sick, nausea, diarrhea, stomach pain. The doctor said she's fine. Ideas? She feels okay today. Well, it's called just observe and try and, if you get diarrhea, I would go on a clear liquid diet for 2 days to rest the gut. So that's like beef broth, chicken broth, and ginger ale, real sweetened with sugar, ginger ale mixed with water to get the fizz out. And give her vitamin D. And I would certainly at least use 5,000 international units. And give her a multi-mineral vitamin. We use Immune Protect, and that has all the nice antiviral mineral, vitamin C, and acetylcysteine in it. And if she continues to stay well, good. If not, then have her see a doctor that will work with that. We have walk-ins for high-dose vitamin C drips. We have walk-ins for EDTA chelation, where the nurse will do a abbreviated evaluation to make sure it's safe for you, so we can give a limited amount of intravenous vitamin C, chelation, things like that as well. And see your doctor and be followed on that. Jennifer said, a friend is scheduled for a breast MRI with contrast as screening for breast cancer because she has the CHIK2 gene. Okay. Is the contrast harmful? The answer is yes. She'd rather not do it. Well, Uh, it all depends on the situation and getting good information. Uh, it depends, just having a gene is not a high risk in and of itself. It's many other things. So if she's overweight, that's a higher risk because overweight people are known to have more breast cancers. What is her age? What is her family history? What is her fasting insulin? What is her fasting blood sugar? What are her triglycerides? What is her hemoglobin A1C? What are her inflammatory markers? And putting all that together, then you can consider, a risk assessment. Now, the good news is we can detox from the heavy metal that they use in the dye for the contrast with EDTA chelation, and she can get that immediately after the contrast study is done, and she can be a walk-in. She should know the day that she's doing the contrast, so she could give us a call because we do schedule things like that. But we do take walk-ins. We don't give as high a dose, but she could do that 2 days in a row, which would be equivalent to one of our main IV chelations and so forth. And then see a functional doctor and guide her. Faith Alone says, hello, Dr. Rita. I eat less sugar and carbs now and losing weight. Praise the Lord. But I heard that my weight must be 51 kilograms fit for my height. I'm 5'3", but now I'm 49 kilograms. Is it okay? Thank you so much. Well, a poundage is not as important as your body mass indices. So what are you composed of? How much of your weight in kilograms or pounds is muscle, lean mass? That would be the key indicator. So you would have to see a doctor that knows how to do your body mass calculations. All right, so it's 7:32, and so my dear TLC Health Freedom Tribe, I'm going to say good night, and from all the staff here at TLC to you all, please like and subscribe and share. Remember now, look at the link below, and then you can type in your questions. I got them all done, so I feel good about that. I will send this to Talon, and he will notify everyone to look for their answer that I called out. And so God bless and have a wonderful evening. All right, take care.